Hey, what's up? Welcome back to my channel. In today's video, I will be showing you how to prime your total parenteral nutrition, also known as TPN, with a micron filter. However, before we get into the skills demo, if you're new here, welcome. My name is Tina, nurse practitioner. Don't forget to subscribe and turn on that notification bell. Let's get started. You want to gather all of your supplies. Most importantly is your TPN bag, which is your total parenteral nutrition. It is prepared by pharmacy and is specific for your patient based on their electrolyte needs. And you also need your micron filter, and then you also have your primary tubing. Something very important to remember regarding your total parenteral nutrition, your TPN should always be administered through a central line access, whether it be a PICC line, a portacath, or your central line. It should never be given through your peripheral IV. Going back to the micron filter, which will help reduce air, bacteria, or any particles to enter into the patient's IV access. So once you have all your supplies, you're gonna put it together. Don't forget your medication rights, right patient, right time, right dose, right route, and right medication. So you're in the patient's room, you've done your hand hygiene, you put your gloves on, you're gonna get your TPN bag and put it on the pole after you have scanned the patient and scanned the medication bar. So you're gonna attach this to your IV pole, and then you're gonna head back to your clean area. You're gonna assemble the primary tubing. So you have your primary tubing, and then I just put it all together. I don't wait until the end. So my primary tubing, I'm gonna take off the cap here, and then I'm gonna take off the cap on this one. And then this is where it filters through, and then it's gonna prime through here, and this point is where it attaches to the IV access. So I'm going to take off the sterile hub, and then I'm going to put it together, align it, and then I'm gonna twist it so that way there's a good seal. So I see that it's together. Now I am going to put my lock on here, and then I'm gonna get my tubing here, and then I'm not gonna quite open this cap yet until I'm ready to prime it. I wait until the very last because I don't want any risk of me knocking it on something and it gets contaminated with bacteria. And then that goes into the patient and hence can lead to sepsis. So anyways, I'm going to remove the clear hub from the TPN bag. So I'm gonna twist it. It's like a little twisty. And then that pulls off, and I will toss that. I have my brakes on here. I'm gonna take off the clear cap because now I'm ready. I'm gonna make sure not to touch the pointy part, and then I'm going to hold it steady with my hand, and I'm going to pierce it in, and nothing's coming out yet because I haven't activated it yet. So I'm going to pinch the hub here and let it kind of go into the center. And now, since the brake is on here, I'm gonna open it up, and it's going to go in steadily fast. And I'm keeping an eye on the micron filter, and I'm kind of keeping it steady, and you can see that it's going through and getting filtered. And then I'll start to put the brake back on. So at this point, I will attach it to the IV pump. I will have it infusing through a set rate based on the doctor's orders, which will be specified in the specific order. And I will also add on a IV change label because this should be changed within 24 hours, and a new bag for TPN will be changed because the patient's needs may be changed as you will be doing blood draws based on the hospital protocol policy. And again, this will be attached to the patient's IV access, and I will continue to monitor it if there's any type of beeping or sounds or alarms per protocol. Don't forget to give me a big thumbs up, comment below, and I'll see you on the next one. Take care.